Welcome to this training on using the UCLA PTSD Reaction Index for DSM-5, or the UCLA PTSD RI for short, as a measure for youth trauma exposure and traumatic stress. In this brief overview, we will review what the UCLA PTSD RI is, as well as how you might administer and score it, and briefly discuss how you can interpret its results and incorporate it into treatment planning. Let's take a moment to review what the UCLA PTSD RI can do for you. First and foremost, it can help to guide decisions regarding appropriateness for care or diagnostic and medical necessity determinations. It can also help us make predictions about how clients will do in treatment by answering questions like, what do our client's symptoms and current level of functioning tell us about expectations for treatment? Along these lines, the UCLA PTSD RI can support decisions regarding which evidence-based practice to use and planning and use for specific interventions. The measure can serve as a progress monitoring metric as well, and serves as a platform to provide feedback with clients and their caregivers. Next, we'll describe how the UCLA PTSD RI is organized. There are three primary parts to the UCLA PTSD RI: the Trauma and Loss Screening section, the Trauma and Loss Detail section, and the Reaction Index itself. It is important to note that although there are two versions of the measure, one for the client and one for the caregiver, they are functionally the same. The primary difference is that the wording is different and that items in the caregiver version are worded to say "my child" rather than "I" or "me." Starting with the Trauma and Loss Screen section, this part of the measure primarily serves as a trauma exposure assessment. That is, the screen section includes items pertaining to a client's exposure to 23 different types of trauma. A benefit of this section is that the items include the language that a clinician can use or the client can reference when assessing for trauma exposure, which helps with both standardization of administering the measure as well as for supporting clinicians and clients with their use or understanding of appropriate, behaviorally specific wording for inquiring about these sensitive topics. This visual is an example of part of the Trauma and Loss Screen. As you can see, for each bolded trauma type, there are questions that follow which serve as behaviorally specific methods for asking about each trauma type. Once the Trauma and Loss Screen is completed, the next section to be completed is the Trauma and Loss Detail section. When a client or caregiver endorses any of the 23 trauma types on Part 1, the Details section includes additional information pertaining to the trauma type, such as the ages at which a particular trauma type was experienced, the client's relationship to the perpetrator if there was one, etc. Importantly, the Trauma Details section should be completed using all possible sources of information. That is, even if the client is unsure about specific details surrounding their trauma experiences, if you have information regarding their history from other informants, including the caregiver, Child Protective Service records, other provider assessments, etc., the Trauma Details section provides a place to include all those sources of information. As with all other sections of the UCLA PTSD RI for DSM-5, the Trauma Details section should be completed at the beginning of treatment and updated accordingly. For instance, if you were to re-administer the Trauma and Loss Screen based on knowledge of exposure to a new trauma type, the Trauma Details section of that new trauma type should also be completed. Similarly, if you are re-administering the UCLA PTSD RI based on agency requirements for re-administration of outcome measures, the Trauma Details section would need to be completed again as well. At the end of the Trauma and Loss Details section, there are two additional important questions. First, if multiple trauma types are endorsed, the client is asked to indicate which trauma type is most bothersome to them now. This is relevant for the Reaction Index section, which they will be asked to complete with the most bothersome trauma type in mind. In addition, based on the most bothersome trauma type, the client is asked to describe briefly what happened to them. This can be written out by the client or clinician, and it provides an opportunity for the client to at least verbally describe in their own words the most bothersome trauma type. This is not meant to serve as a full trauma narrative. Rather, completing this item serves as a method for reinforcing the client's understanding that they should keep the most bothersome trauma type in mind when answering the next set of questions. It also, at times, can provide some understanding for the clinician about how much insight and understanding the client has about what happened to them. This visual demonstrates what some of the items look like on the trauma and loss detail section, including checkboxes for characteristics of each trauma type, the age or ages at which the client experienced the trauma, and other details. This visual demonstrates the items that ask about the most bothersome trauma type. There is space to write the trauma type, as well as the section to write out more details regarding what occurred. In this example, the clinician briefly described the client's most bothersome trauma type, which involved the client witnessing his father be physically assaulted by gang members. Once you have completed the trauma and loss screen and detail sections, you're ready to move on to the reaction index section. There are 27 items on the UCLA PTSD RI in the reaction index section. These items assess for different symptoms of PTSD from the DSM-5, and 4 additional items assess for whether or not the client is experiencing dissociative symptoms. As previously mentioned, the client should be instructed to complete this section with the trauma experience that they identified as most bothersome in mind. The items in this section are rated according to frequency. That is, how often an item has occurred for them in the past month. This visual shows what some of the items in answer format look like from the reaction index. As you can see in the instructions, clients are instructed to consider their most bothersome event and rate the frequency of each item for the past month. For many clients, it is helpful to provide a visual aid to help them understand answering items based on frequency. This example of a frequency rating sheet demonstrates approximately how many days, denoted by X's, out of a month they would be experiencing a particular problem, according to the UCLA PTSD RI answer format of none, little, some, much, and most, or the 0 to 4 scale. This can help youth accurately reflect the frequency of their symptom experiences and is provided to you as part of your UCLA PTSD RI license. Another part of the reaction index includes answering a few questions regarding the level of distress or functional impairment that is caused by the problems represented in the reaction index items. This is important information to help you determine the severity of symptoms a client is experiencing, as well as to provide critical information to determine if diagnostic criteria are being met. Once you have completed the 3 parts of the UCLA PTSD RI, you are ready to score it. You will want to ensure that all of the reaction index items are answered to the best of the client's ability, and if they have completed the section on their own, you should quickly scan the items to ensure that they've been answered. One difference to note between the youth and caregiver versions of the measure is that the caregivers have the option of answering "don't know," given that there are a number of internal experiences listed on the reaction index that they may not have enough information on the child to be able to answer accurately. These don't know answers are not able to be scored, however, so they are treated as missed items and will not be calculated in the final score. The UCLA PTSD RI can be scored by hand using the template shown here, which is also part of your licensing purchase. Each symptom category from the DSM is represented, including the subtype items and the impairment items. One aspect of the UCLA PTSD RI that is especially unique is that it can be used as both a diagnostic tool and a progress monitoring tool. As scores lower on the measure, this is an indication that the client is experiencing improvement over time. For scoring the measure, first copy the scores you received on the reaction index portion of the measure into the relevant space on the scoring sheet. For each category, add the scores to determine the symptom category summative score. Do this for each subsequent symptom category. Certain items have asterisks next to them. For these, you should record the highest score of the 2 into the blank. Next, you will add the summative scores to get the total score. The total score can range from 0 to 80. Recent research has suggested that a score of 35 is the best cutoff to distinguish between clients who meet criteria for PTSD and those who do not. So 35 is the best approximation of a clinical significance score. In order to make a diagnostic determination, simply count the number of symptoms that are considered present for each category. To meet the criteria for a diagnosis of PTSD, at least 1 symptom must be present in both B and C categories, and 2 symptoms must be present in both D and E categories. This section of the scoring sheet shows the symptom category breakdown and allows you to indicate whether or not a category has been met by checking off the box. An additional checkbox also allows you to indicate whether or not the minimum number of dissociative symptoms are present to meet the dissociative subtype of PTSD. You also have access to a scoring program within your UCLA PTSD RI license. In the scoring program, the data entry fields match what is on the demographic and reaction index portion of the UCLA PTSD RI and are pretty self-explanatory. As you can see here, you will enter the client information first and then the answers from the reaction index section of the measure. Once the answers are entered, click Symptom Analysis and a document will be generated that looks like this. The subscale scores are generated on this symptom analysis, and the traffic light graphics allow you to see which symptom areas are most elevated, which are denoted by the red light. This also can serve as a helpful visual when reviewing scores with your clients. In addition to learning how to administer and score the UCLA PTSD RI, it can be helpful to consider how it fits into an overall care process model for trauma. A care process model is a framework for implementation of evidence-based practices such as trauma screening and trauma assessment. Care process models can guide decision-making and allow providers, administrators, and systems to identify risk and make a plan for scaling up or down evidence-based interventions throughout an episode of care. The care process model highlights a number of considerations for the UCLA PTSD RI, which may be important for you or the system you work in to consider in your implementation work. For instance, how can we be sure we are identifying all youth in need of trauma treatment within our system? Other considerations, such as decisions related to the integration of the measure into an electronic health record, diagnostic considerations, treatment individualization, program evaluation, as well as how the UCLA PTSD RI can be utilized across different roles and to serve as a basis for data-driven decision-making. These are all considerations that may benefit from further consultation or training. Contact information for Hathaway Sycamore's Research and Training Institute will be provided at the end of this webinar should you be interested in pursuing these next steps. If you are interested in learning more or ordering any version of the UCLA PTSD Reaction Index, you can find ordering information at Behavioral Health Innovations, LLC, which is found at reactionindex.com. In addition to the tools, if you are interested in further training and/or consultation opportunities, including further guidance on implementing the UCLA PTSD RI, the care process model, or other clinical applications, please contact Community Research at hscfs.org or go to hathaway-sycamores.org/institute. Thank you for your attention and participation on this webinar. We hope this information was helpful, and we thank you for the work that you do.